Do you see this static? What do I do? Take 2. Action. What's up, guys? Today I'm going to be answering a very common and I think a very good question, and that is, what does it feel like to faint? I've been thinking about exactly how I feel like I can answer this question for you, and I feel like it's a little bit like trying to describe what green is to somebody who's colorblind. I haven't the slightest idea of where to start, but I've been thinking about it for a couple of days. I feel like maybe I'm ready for it, and so let's just give it a shot. I would assume, but I'm not positive, that the reason that you faint probably factors into how you feel when you faint. Like, I assume that someone who sees blood, gets a rush over them and faints because they're really lightheaded suddenly is going to feel different from what my situation is, which is a bunch of palpitations and sweats and stuff like that. So I guess what I'm trying to get at with this sentence is, keep in mind this isn't going to be everybody's faint story. This isn't going to be how everybody's faints go. And if we're being totally honest, my faints have changed in the way that they present, and they change based on where I am in my migraine cycle. So just like no 2 migraines are the same, no 2 faints are the same. Even things like what I've eaten recently can change how the faint progresses, because my situation is very sensitive to salt. So that makes this a little bit difficult to explain too. I'm already not sure if I'm making sense. Usually when you try to explain something to someone, you have them sitting in front of you, and you can be like, oh, so you know when this happens, and they can let you know yes or no, and you can alter your story based on the feedback that they're giving you. You know what I'm talking about? Cricket, cricket. And that's my point. That makes this so hard to explain to you because I don't know your background, and I don't know if I'm making any sense when I'm saying this stuff to you. And that is how I feel every freaking YouTube that I make, but this one especially, because it's just something that's weird to explain. It's not something that I've been asked to explain out loud very much, because I didn't start fainting until maybe a few months before quarantine started, so it's not like I've been hanging out with a ton of friends. But let's get on with it. Why do I faint? I have 2 main diagnoses that factor into why I faint. They are called POTS, postural orthostatic tachycardia syndrome, and orthostatic hypotension. If you are familiar with one or both of these conditions, little alarms should be going off in your head right now, because the definition of POTS specifically states in the absence of orthostatic hypotension, meaning in order for your condition to be POTS, it can't be orthostatic hypotension. So how am I diagnosed with both? We think it might be related to my migraine cycle. What I think is happening, based on my limited memory of events, is I am very classic POTS when I don't have a migraine, and migraine gen tends to have lower blood pressure. And as my migraine cycle ebbs and flows, so do my cardiovascular things, symptoms. Oh gosh. To get a little bit more specific, POTS, postural orthostatic tachycardia syndrome, is basically a high heart rate upon standing. Postural and orthostatic both refer to the fact that the condition changes or is exacerbated by changes in position, or whether I'm laying, sitting, or standing. And the definition of POTS is that your heart rate increases by 30 or more beats per minute and is sustained within 10 minutes of standing, in the absence of orthostatic hypotension. Orthostatic hypotension is, again, orthostatic meaning when you stand up, and hypotension is low blood pressure. So orthostatic hypotension just means that your blood pressure drops when you stand up. Normally when you stand, your vessels are supposed to constrict in your legs to keep the blood up in your heart and in your head. But for me, it appears that isn't happening. And sometimes that can mean that my blood pressure drops too low and I need to sit down or lay down, or I suddenly get forced to lay down because I stood up too fast. Alternatively, on what I call a POTSy day, my heart rate will spike, but my blood pressure will remain constant. With POTS, the symptoms are usually alleviated if you sit back down or if you lie all the way down. And if you watched my tilt table test video, I'll throw a card here, you saw that happen. With hypotension, I feel like that's not quite as much the case, although sometimes laying down totally does make a difference. With both conditions or both scenarios, sometimes sitting down or lying down doesn't do the trick, and I end up fainting anyway. And that's kind of just a too bad situation. There's a lot that I can do, and I made a video about how I prepare to faint. I'll put a card here. And those things do help a lot, but sometimes there just isn't anything that you can do. So what exactly does that feel like? The purpose of this video. Let's try to get into that now. Driving me crazy. Better? Better. Okay. So, you want to faint. The first thing that has to happen is some trigger. Sometimes the trigger is you're awake. You exist. It's just time to faint. That's harsh, but it's reality. Sometimes there is a clear-cut trigger. Like for me, if I'm laying down in bed and I just stand up, bad news. When I wake up in the morning, I sit up in bed for a little while first, and then I attempt standing up. Sometimes the trigger is a little bit of exertion, like walking up the stairs. Sometimes the trigger is it's hot. Sometimes the trigger is I ate something. Sometimes the trigger is overstimulation, a lot of talking, a strobe light, a lot of touching on my skin, like a shower, alcohol. Either certain types of alcohol, or if I have 3 beers instead of 2 on a day that I didn't realize I was susceptible to it. Sometimes when the trigger happens, all that happens is I get brain fog. I do feel like I spend a good majority of my life with at least some level of brain fog, and I'm able to push through it really well, but sometimes the brain fog is bad enough that, for example, I have forgotten who my husband was. I have cried because the light was out, and I didn't know how to turn it back on, and I was afraid of the dark. Like, these levels of confusion can get very severe, and sometimes that's as far as the episode goes. But we're going all the way to a faint, so let's move forward. I think a lot of people have felt that lightheadedness if you stand up too fast, and that's definitely a big part of it for me. That usually comes with some dizziness, some vertigo, going backwards. It's always going backwards for me. A sudden flushing, like, oh gosh. For you other mamas out there, that postpartum flushing when you're going through your menopause, it's like that. It's a clammy feeling, almost like a flu, like when you get a fever. I can feel it sweating through my face and my hands. Of course, I forgot the most important freaking symptom, and that is the palpitations. Heart rate going really, really fast. Feels like you're going for a jog, like you just went for a jog or did some CrossFit. I miss CrossFit. And by the way, sometimes for POTS, sometimes that's all it feels like is you're walking along and suddenly it feels like you're going for a jog. And you're like, what the heck? I'm just standing in line at the grocery store. Why am I suddenly having these palpitations? But, you sit down and a lot of it becomes alleviated. But if you don't, the world starts to go black and it all kind of caves in a little bit. At this point, your body's kind of in fight or flight. And for a lot of POTSies, you really do get an adrenaline rush when this happens. I think everybody's felt an adrenaline rush before, right? I don't feel like I need to explain that. But it's like you almost got in a car accident, or you almost fell off your bike, or you're running from a bear, because we've all been in that situation before. Your body is like, this is an emergency, shut down everything, we're focused on either running or beating up a lion. In some patients with POTS, the heart rate becomes so rapid that it's no longer efficient, and their blood pressure will drop as well. So some POTSies do have a drop in blood pressure. I don't know what makes that drop in blood pressure not count as orthostatic hypotension. Don't at me, guys. Technicalities is not what this video is about. I more want to just explain the feelings that are going on. If I'm going to fully faint at some point in a day, usually throughout the day I feel a little bit off. And sometimes it's hard for me to tell the difference between I'm going to faint later and this is a migraine coming on. So thankfully I do have that medical alert dog. But a lot of the time I do feel the faint coming for quite a while throughout the day. And then suddenly the palpitations will come later in the day when I walk up the stairs or something. But sometimes I feel like I'm having a really good day and then I start to get really bad tachycardia. If I felt good during the day and not like a migraine was coming, then usually I don't faint all the way. Usually a good day does actually end up being a good day. But that's also because I'm really in tune with my body, really consistent on my diet, really mindful of my triggers. Like hydration. Oh, ow. I am so strict on hydration, and that really makes a big difference when it comes to fainting. I have had episodes happen where I start getting the rushes, I start feeling like I'm gonna faint, I lay down, I put my feet up, I do the salt, I do the compression, all the things that I mentioned in that preparing to faint video, and it still just isn't enough. I have had my palpitations, my pounding, racing heart rate keep going for a couple hours, and when that happens, you start getting chest pain. You get really tired. Breathing becomes labored and intentional, and you just don't really know how to get out of it. And I guess that kind of makes sense because it's a lot of work. Chest pain is a particularly scary symptom, and at the point where I was getting chest pain, I was also really lightheaded, fading in and out, double vision, blurry vision, improper vision. Freaking words. Like the world looks like waves, almost like a visual aura for a migraine, but it's just because your body is getting hazy and confused and your brain isn't getting enough oxygen, so everything just looks weird. The first time an episode like that happened to me, I got to the hour-and-a-half mark and started getting the chest pains, and at about an hour 45 or 2 hours, it just became too much to bear, and I ended up going to the emergency room. Hey, is there something wrong in my heart right now? They hooked me up to an ECG, the heart wave thing to see the electrical signal. Everything in the signal was fine. My sinus rhythm was normal. My heart was beating at relatively regular intervals, even though they were very fast intervals. They could find no reason for my chest pain. A lot of ER doctors haven't heard of POTS. Actually, a lot of doctors haven't heard of POTS or dysautonomia. I did happen to get an ER doctor that had heard of POTS, and he did a poor man's tilt table test for me there in the emergency room and said, hey, you're testing positive for POTS. You should go to cardiology. Ribbit. So I'm lucky that my ER doctor had heard of POTS, but then when I went to a cardiologist, that cardiologist hadn't heard of POTS. And POTS is actually a neurological condition, but a lot of the time it does get diagnosed by a cardiologist because it presents as a heart rhythm problem. Tachycardia, usually a cardiology thing. It is really tough when you have a condition like this that not a lot of staff at the hospital have heard of. It makes you feel really alone and like a little bit crazy, like it's in your head, and they accuse you of having anxiety, and that's not quite what this is. In fact, that's not at all what this is. I haven't opened up about my mental health struggles on here at all yet, but I have had a history of depression. I have battled anxiety. Anxiety for me is much worse than depression. I have had panic attacks out of nowhere. I have had PTSD-related panic attacks, so I know what those feel like. And this is distinctly not that. I have an itch on my cheek and I don't want to make my cheek red by scratching it, but I have to. While we're on the topic of mental health, I do want to pause just for a moment and thank you guys for being here and being supportive, because being chronically ill is extremely difficult on your mental health. A lot of you guys know and understand that. For me personally, having chronic migraines is something that got me very depressed because I was losing so much of my life, and it took a lot to learn how to not feel depressed about this being my fate. And then when all of my heart stuff started happening, that really increased my anxiety. Understandably so. If you're constantly in stress, you're going through these fight or flight responses just from waking up in the morning, just from sitting up. If your heart races randomly and you're not very mentally aware of it being because of your condition and not because of something that's going on your surroundings, it's really easy to feel your heart racing and think, oh my gosh, what is it that I'm so nervous about? You know, it's naturally a nervous feeling when your heart starts racing. So of course people with chronic illness end up getting depression, anxiety, sometimes because your body's symptoms are matching those disorders, and sometimes because it's really impacting your freaking life. Like, if migraines are taking away more than half your life, or like me, I'm getting chronic daily migraines, of course it's going to depress you. And if your migraines come with symptoms that act like stroke, and your doctor is just putting you on medications that are actually giving you heat stroke and making your hair fall out in chunks, and that's really your only alternative, of course your anxiety is going to be through the roof. Of course, any little different twinge in your body or change to your aura can give you anxiety. Like, it's totally valid to be feeling those struggles. This tangent is going on way longer than I intended for it too, but I do want to talk a lot about my mental health in 2021 and some of the things that I've learned from my 4 years of going through this, and what I have done to bring meaning back into my life and fight those emotions. End tangent. Thank you guys for being here. I know that you guys are thankful that I make you feel less alone because I share all of these things, but it goes both ways. Your comments telling me that you're going through this and that we're in this together also mean a lot to me. Obviously, I'm very upset that you are going through it. I don't want anybody else to go through it. But I really do feel like you guys are my friends. It's super weird. You guys are like a really big 20,000 member family to me. So thanks for being here. Thanks for being supportive and for understanding that it's vulnerable to put myself out. Obviously, it increases anxiety to be posting stuff on the internet where you can get very scrutinized for every little thing that you say. And yeah, you guys mean a lot to me. Let's get back to the part where we're on the floor and we're about to faint. There's a certain point at which you're laying on the floor, and despite your preventative actions that you took, if any, you feel like you're losing the battle. And I call that browning out. It's not quite blacking out, like you're not all the way out, but you're kind of fading in and out. It's starting to happen. It might actually happen. You might be able to fight it, but you're kind of in that limbo. And for me, that can be very similar to like trying to stay awake from a nap, but it's a nap where you're already dreaming because your vision is really wonky. It's almost like you're underwater. Like, it's a little bit hard to breathe. For me, my chest can get kind of heavy, like someone's sitting on it. At that point, hearing becomes muffled. I'll be less responsive because I'm so tired. And I want to say I'm not necessarily tired from being almost fainted, but I think at that point I'm probably tired because my heart's been racing for so long, or because my body is trying so hard to fight falling asleep. Maybe that's what's going on there. Because it's not like falling asleep tired, but it is like very tired. At that point, limbs are also very heavy. Reaching one hand over to other arm to try to push the button on the blood pressure cuff is not the easiest thing to do. Did I look like I was holding the telescope? It's like the Eiffel Tower. I think I already said it. Muffled hearing, like you're underwater. I can tell people are talking to me and I want to respond, but I can't. Too much effort. When I'm in that limbo state, if my husband starts squeezing my legs, it's almost like someone wiped me with a cold washcloth or something and it just brought some life back. Oh! I wonder if that would help, actually. I wonder if a wet washcloth would help. Have any of you guys ever done that? Can you put that in the comments if you ever tried like a wet washcloth if you're about to faint? Would that kind of like wake you up? Because Buddy, my service dog, he'll come over and like lick me to try to get me to wake up. He'll lick my hand or nibble at it or lick my face to try to snap me out of it. I wonder if, I might add that to my basket. Oh, guys, that's my basket actually, right there. That brown basket right there where my finger is, that's my faint basket. This is my side of the bed. My husband's side of the bed is the one with the telescope. I have a faint basket. He has a telescope. Priorities. So yeah, at that point, either you're going down or you're waking up. What's it like waking up from a faint? That also depends. I think it depends on a lot of things. It depends on what I've eaten recently, how much salt is in my diet. It depends on how many things I did preventatively to try to make it so that the faint didn't happen. It depends on where I was in my migraine cycle when I first started the faint. Probably depends on how long I took to lay down. Probably depends on how long I was out. I don't really know. I just kind of roll with the punches when they come. But there are kind of two main ways that I feel after a faint. Really good, like I just took a power nap, or really bad, like I just got hit by a bus. Waking up from a faint can be totally freaky deaky. Have you ever had your alarm go off in the morning and you hit snooze and then suddenly it's going off again and it's already been 10 minutes and it's literally like you blinked and it's been 10 minutes? That can totally happen from the faint. But usually if I'm about to faint, I'm not looking at the clock. Like I'm not timing what time did I go out or anything like that. That's not on my mind at all. The only thing on my radar is keep your eyes open, try not to fall asleep, look at the light, but not that light, a light, stay awake, snap out of it. I don't freaking care what time it is. I don't care how long I'm out. Like if I'm out, I'm out. If someone else wants to help me wake up, that's great, but at that point, I'm asleep. Point being, the trippy thing that happens that's similar to the alarm clock is maybe someone will be over here and then all of a sudden, poof, they're over here. Like, how did you get over here? And it's just because I'm fading in and out. So that can be kind of trippy. Sometimes when I wake up, I feel like I just took a power nap. I'm nice and recharged. I feel ready to tackle the day, or at least I feel like I felt before I fainted. Like, let's say I stood up, I felt really faint, I fainted, I wake up, 10 minutes later I'm decent. In my preparing to faint video, that one I kind of came in and out a little bit, and then I felt really good after. You know, I felt all right. And I probably did still get a migraine that night because that's my normal cycle, but I didn't get a migraine specifically from that faint right away. And the reason I say that is because, I should switch sides. Sometimes when I wake up from a faint, it's basically immediate that I'm in full migraine gen mode. And you guys know migraine gen. Migraine gen is nice and slow. Migraine gen likes to leave plastic on the stove when the stove is on. Migraine gen is this completely different alter ego lady. I'll put a card here for my playlist of videos where Migraine Jen did the video. I'm a totally different person when I'm Migraine Jen. And sometimes when I wake up from a faint, unfortunately, that's just where I'm at for the rest of the day. When the faint happens, sometimes I wake up and I can't speak in complete sentences. I'm foggy like I got woken up in the middle of REM. You know how that is. I just move really slow and can't make normal sentences, and at that point usually I start getting my typical migraine auras, the stars, the ear bombs, and then I go into the migraine attack phase within the next hour-ish. I'd be surprised if it was after an hour. I'm just throwing out numbers. And I can't stress enough how variable these symptoms really are. I'm only one patient, and within me it changes a lot. I'm sure from me to the next guy it's going to be completely polar opposite stories. A lot of these conditions seem to not be very well understood. Like, migraine is terribly under-researched. Dysautonomia and POTS, I feel like they're just starting to make a showing suddenly. A lot of my doctors have never heard of it or only heard of it recently. So a lot of the time when I go to the doctor, I have to explain what my problem actually is. So that's kind of weird. So, in conclusion, fainting. Not the funnest feeling that I've ever had, but also not the worst feeling that I've ever had. A little bit difficult to explain, but I hope you kind of get what I'm saying. This video ended up being what it feels like to faint, plus a little extra stuff. But I guess that's all my videos, because I do these tangents a lot. Jen Rambles. I still sometimes feel like this channel should be called the Jen Rambles channel. I can't stay on topic. As always, I want to hear from you, so please let me know in the comments if you faint, and if you do faint, are your faints very different from mine? I enjoy using this platform as a way to crowdsource with you guys and create these databases in the comments of how other people react to the same conditions, you know? Do I say you know a lot? It's really time to end this video now, but for next week's video, I'm going to be telling you guys how I figured out my allergies, like my food allergies, what my food triggers are. I have a couple of weird ones, soybean oil, but not soy lecithin, and milk fat, but not regular milk, and those are very weird allergies. So I'm going to explain it all next week and let you guys know how I identified my food triggers without going through a really strict elimination diet, because let's be honest, the last thing a migrainer wants to do is be put on some diet where you have to be cooking all the time and meal prepping and super strict on it, because that is not convenient. You don't have time, you can't remember, and it's just not something that you can do. You can't cook a bunch of meals with a migraine, as you guys know from that Migraine Jen cooking vlog. I'll throw a card here. I actually have one more video suggestion for you because so many of you guys want to see more of Buddy, and last week I finally did a video about his tricks. So it's 25 straight minutes of Buddy being Buddy. Here's a card for that. So, make sure that you're subscribed, hit the notification bell, and turn on all notifications if you want to get a little bing when my video goes live next week and all weeks. Hit thumbs up if you enjoy videos on this topic, on this kind of like fainting topic, and I'll see you guys next week with that food allergy video. When I hit this button, I get my song stuck in my head. Almost every time. Ding, 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 ding. Killed it.